Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Angiosarcoma. Angiosarcoma is classified as many types. It is de novo angiosarcoma or the angiosarcoma which occurs post radiation, or the angiosarcoma which arises in association with post mastectomy lymphedema. So this angiosarcoma can arise in three ways. One, it can arise de novo, that is on its own, or it can arise uh, through after radiation, or it can arise after post mastectomy lymphedema. So these are three ways of um, arising or ways of origin of angiosarcoma. Then, according to Steve and Travis, they described angiosarcoma as lymphangiosarcoma. It is a lymphangiosarcoma of upper extremity, and this lymphangiosarcoma of upper extremity is seen in women with ipsilateral lymphedema. Here there is this is a lymphangiosarcoma of upper extremity in women, and it is seen as an ipsilateral lymphedema. And where do you see this? This is seen after radical mastectomy, and this is actually called as, because it is discovered by Stewart and Trives, it is called as Stewart and Trives syndrome. But angiosarcoma is the one which is preferred now. There is, so if you see the average interval, when does angiosarcoma develops, the average interval between post um, after radical mastectomy and angiosarcoma development is, that is, it develops after 10.5 years after modified radical mastectomy or radical mastectomy. So mainly this angiosarcoma will actually develop almost 10.5 years after modified radical mastectomy or radical mastectomy. It does not develop so soon. So then 60% of women who are developing this angiosarcoma have history of adjuvant radiotherapy also. So adjuvant radiotherapy plays an important role in lymphangiosarcoma. Then clinical features of angiosarcoma. A patient with angiosarcoma will present with worsening edema, and the edema is acute worsening of edema is seen, and there is appearance of subcutaneous nodules are seen along with hemorrhage. There is appearance of subcutaneous nodules are seen with hemorrhage and ulceration. So the main differences in clinical features between the radiation induced carcinoma and angiosarcoma without any radiation are different. So radiation induced angiosarcoma, in radiation induced angiosarcoma we will see reddish brown to purple raised rash is seen, and this is seen in the radiation portals wherever the radiation is done, and it is seen also on the skin of the breast. So radiation induced angiosarcoma is seen mainly in the radiation portals and on the skin of the breast, and it is reddish brown to purplish in color. Then we have angiosarcoma without previous radiation history or surgery. Without previous radiation therapy or surgery, in this angiosarcoma may form as a mass in the parenchyma of the breast. Then treatment of this angiosarcoma. So the treatment of this angiosarcoma includes, here we have to give pre-operative chemotherapy can be given to the patient with radiotherapy. We can give pre-operative chemotherapy with radiotherapy, followed by a surgical excision can be done. This is actually associated with poor prognosis, and sometimes 4-quarter amputation may also be necessary, mainly if for palliation of ulcerative symptoms. or ulcerative complications, we can do the four quarter amputation. That is only amputating the part of angiosarcoma. This is done if there are any ulcerative complications.
Thank you and thank you for watching.